To health matters now, where Kenya's health sector has witnessed key reforms, all aimed at attaining the universal health coverage dream, as enshrined in Article 43 of the Constitution. In a bid to confront some of the challenges in the critical sector, the government has officially opened the Kenya Health Summit, themed reforms delivered. Health as a right. Elizabeth Otieno has more.
On Tuesday, over 10,000 delegates flocked the KICC building as the Kenya Health Summit 2026 officially kicked off. The government, led by President William Ruto, took to the podium lauding some key reforms in the health sector streamlined through digitization, also made possible by the distribution of 42,300 digital devices across all facilities.
Digitization is not simply about replacing paper with screens. It is about making every patient visible, every treatment traceable, and every payment accountable.
The implementation of universal health coverage has been made possible through the Social Health Authority, which has so far collected 209 billion Kenya shillings and paid out 178 billion Kenya shillings to health facilities, with counties receiving 46 billion. All this with an aim of ensuring Kenyans do not pay out of pocket for health services.
A facility that ordered 10 essential commodities received fewer than 4. Today, that rate stands at 95%.
So far, 32 million Kenyans have registered with SHA. Of these, 8 million, including 1 million expectant mothers, have benefited from the insurance cover.
Out of which, 31.4 billion has been paid to hospitals through the Social Health Insurance Fund, SHIF, and 14.2 billion has been reimbursed to primary health care facilities.
The 107,000 community health promoters scattered across the country have been cited as a bridge linking the community to health facilities. While addressing a section of the CHPs, President William Ruto called out his political opponents who have time and again faulted SHA, describing them as naysayers with a no concrete plan to transform the country.
And we will tell you until you understand that SHA is working. Ama namna gani? Wale wa jamaa tutawapasha bana. Unajua uongo na ujinga hubamba mafala.
Actually, one politician said, on day one, I'll scrap SHA. To replace with what?
The two-day Kenya Health Summit seeks to showcase some of the transformations in Kenya's health sector under the bottom-up economic transformation agenda, demonstrating how whole-of-government and society approach is spearheading this transformation. Discussions centered on universal health coverage, healthcare financing through SHA, digitization of healthcare, and strengthening the local manufacturing of medicines have taken center stage during the summit. Elizabeth Otieno, TV47, Nairobi.
Right, and we want to take you straight to the presidential town hall where the National Health Summit is underway right now. Just as Elizabeth Otieno has given you the scoop, we want also to get the feel and the flavor of what is happening currently. Let's listen in.
Minimum of 15,000 or even sometimes a maximum of 15,000 shillings. If the operation is even going to cost about 300,000 or even 400,000, they only get 15,000. So the deal is actually too good for us. And that's why we decided to maximize getting all the 15 theaters. So we did not pay a penny for those theater equipments. We never paid a penny for the CT scans. We have never paid a penny for the Linac machine. We have not paid a penny for the mammogram, which we have a modern advanced mammogram for breast cancers management diagnosis.
Let me, can you give us your experience on SHA reimbursements?
Thank you, Your Excellency. I want to go back to 2013 when I left Kenyatta National Hospital. We used to operate under NHIF. We have a bed capacity of we had a bed capacity of 1,800 beds. Today we have 2,200, almost 2,300 beds at Kenyatta National Hospital. NHIF patients were only 60% covered. We had only 60% patients on NHIF at KNH. Today, under SHA, we cover 90% of our patients, or 91 to 92% of our patients under SHA. And we have managed to get, as I can confirm today, Your Excellency, we have received 4.2 billion shillings from SHA in the last 18 months. So, and I think as I've heard from one or two individuals from the county facilities, I want to confirm also that SHA works. And I can tell it to all Kenyans that we have had 1 million patients passing through Kenyatta National Hospital as outpatients. We have also had 900,000 patients passing through Kenyatta National Hospital in the last 1 year. All of them have been paid by SHA, including the emergency patients.
So, are you telling the Kenyan public that the 1 million people you treated in Kenyatta Hospital on outpatient came in, they were treated, given drugs, and they left without paying a penny, and SHA paid for them?
Yes, Your Excellency, I want to say this with no fear of contradiction. I've been there for the last, I think, 10 months, 11 months. That's what has happened. I can also confirm that 9 months ago, I was in Jaramogi Oginga Odinga Teaching and Referral Hospital. And I was there for 18 months. And Your Excellency, when I was there, we actually received.
And that is Dr. Richard Lisiampe, who is the CEO of the Kenyatta National Hospital, just apprising the Presidential Town Hall, which is holding the National Health Summit, where we have also the President presiding it, and giving an update of how the Kenyatta National Hospital is faring as far as also the SHA is concerned and other equipment that they have been able to attain right now. Of course, we shall be doggedly following this story tomorrow and updating you on what will be happening as well on that particular summit. Right.